Uh, Hi. Today, I'd like to talk about a very important but difficult subject, which is what is the order in treating things when things get complicated? The vast majority of the people that I work with have mold toxicity, Lyme disease, mast cell activation, limbic and vagal dysfunction, methylation dysfunction, mitochondrial issues, positive titers to a variety of viruses such as Epstein-Barr and HHV6, and more. And with all of the consultations that I do, one of the most difficult aspects for practitioners is what to treat in what order. And so let's briefly talk about that. If someone has a viral issue, mold toxicity, and Lyme disease, in my experience, treating the mold is first. There are a number of reasons for that. First, the mold is less invasive. If we're going to treat Lyme disease, we're almost always going to use antibiotics, which will mess with an already messed up dysbiotic bowel, and that's problematic. Most of the people I treat are very sensitive. They can't treat Lyme first because of its complexity. Second, the symptoms of mold toxicity and Lyme disease are so similar that it's really difficult to tease it apart. So I often find, especially in patients who've been treated for Lyme for some time, that their practitioners keep treating Lyme thinking that the symptoms they're looking at are Lyme or Bartonella or Babesia, when actually they're mold toxicity that hasn't been addressed. So when we treat the mold toxicity and we remove that layer, often people are completely well and we do not need to go down the Lyme rabbit hole, and that is unnecessary. So treating the mold first is paramount. We often don't need to treat the viral component either. Both mold and Lyme weaken the immune system to such an extent that allows other infectious agents like Epstein-Barr and HHV6 and Coxsackie and other viruses to enter into the picture. But if you heal the mold and Lyme, the immune system is able to completely reboot, and rarely do we need to treat the viral piece. So the viral piece is not something to treat first. It's in some ways a distraction. It does not explain the vast majority of our patients' symptoms. And unfortunately, I see people who are treating the viral component, methylation dysfunction, mitochondrial dysfunction first, not getting anywhere because they're not dealing with the primary root cause. So in that scenario, with someone with a variety of issues, which include long haul COVID, we treat mold first. However, in our sensitive patients, if we don't also look for limbic, vagal, and mast cell issues early on, if those are not addressed, our patients will not be able to take the materials we need to give them to cure the mold. So in terms of order of treatment, for someone who's sensitive, we start with limbic and vagal first, then mast cell activation, then mold. And then if we remove that layer completely, then we can deal with whatever is underneath it much more successfully. So I hope that's helpful in understanding the order of treatment because that is so important for our complicated patients. And in my second edition of my new book, Toxic, we go over that in much more detail. And I would encourage you to read that in order to get a better grasp of what I'm talking about. So great. Have a wonderful day.